Question 1. The postpartum nurse is taking the vital signs of a client who delivered a healthy newborn 4 hours ago. The nurse notes that the client's temperature is 100.2 degrees Fahrenheit, 37.8 degrees Celsius. What is the priority nursing action? 1. Document the findings. 2. Notify the obstetrician. 3. Retake the temperature in 15 minutes. 4. Increase hydration by encouraging oral fluids. Explanation. Question 1. Rationale. The client's temperature would be taken every 4 hours while awake. Temperatures up to 100.4 degrees Fahrenheit, 38 degrees Celsius in the first 24 hours after birth often are related to the dehydrating effects of labor. The appropriate action is to increase hydration by encouraging oral fluids, which should bring the temperature to a normal reading. Although the nurse also would document the findings, the appropriate action would be to increase hydration. Taking the temperature in another 15 minutes is an unnecessary action. Contacting the obstetrician is not necessary. Test-taking strategy. Note the strategic word, priority, and use knowledge regarding the physiological findings in the immediate postpartum period to answer this question. Recalling that a temperature elevation often is related to the dehydrating effects of labor will direct you to the correct option. Also, increasing hydration relates to a physiological client need. Question 2. The nurse is assessing a client who is 6 hours postpartum after delivering a full-term healthy newborn. The client complains to the nurse of feelings of dizziness. Which nursing action is most appropriate? 1. Raise the head of the client's bed. 2. Obtain hemoglobin and hematocrit levels. 3. Instruct the client to request help when getting out of bed. 4. Inform the nursery room nurse to avoid bringing the newborn to the client until the client's symptoms have subsided. Explanation. Question 2. Rationale. Orthostatic hypotension may be evident during the first 8 hours after birth. Feelings of dizziness are signs that caution the nurse to focus interventions on the client's safety. The nurse would advise the client to get help the first few times getting out of bed. Option 1 is not a helpful action in this situation and would not relieve the symptoms. Option 2 requires a prescription. Option 4 is unnecessary. Test-taking strategy. Note the strategic words, most appropriate. Focus on the subject, client safety. Option 4 is unnecessary and is eliminated first. Elevating the client's head is not a helpful intervention. To select from the remaining options, recall that safety is a primary issue. Question 3. The postpartum nurse is providing instructions to a client after the birth of a healthy newborn. Which time frame would the nurse relay to the client regarding the return of bowel function? 1. 3 days postpartum. 2. 7 days postpartum. 3. On the day of birth. 4. Within 2 weeks postpartum. Explanation. Question 3. Rationale. After birth, the nurse would auscultate the client's abdomen in all 4 quadrants to determine the return of bowel sounds. Normal bowel elimination usually returns 2 to 3 days postpartum. surgery, anesthesia, and the use of opioids and pain control agents also contribute to the longer period of altered bowel functions. Options 2, 3, and 4 are incorrect. Test-taking strategy. Focus on the subject and use general principles related to postpartum care. Eliminate options 2 and 4 first because of the length of time stated in these options. From the remaining options, eliminate option 3, because it would seem unreasonable that bowel function would return that quickly in the postpartum client. Question 4. The nurse is planning care for a postpartum client who had a vaginal delivery 2 hours ago. The client required an episiotomy and has several hemorrhoids. What is the priority nursing consideration for this client? 1. Client pain level. 2. Inadequate urinary output. 3. Client perception of body changes. 4. Potential for imbalanced body fluid volume. Explanation. Question 4. Rationale. The priority nursing consideration for a client who delivered 2 hours ago and who has an episiotomy and hemorrhoids is client pain level. Most clients have some degree of discomfort during the immediate postpartum period. There are no data in the question that indicate inadequate urinary output, the presence of client perception of body changes, and potential for imbalanced body fluid volume. Test-taking strategy. Note the strategic word, priority. Use Maslow's hierarchy of needs theory to eliminate option 3, because this is a psychosocial, not a physiological, need. To select from the remaining options, focus on the data in the question. Question 5. The nurse is providing postpartum instructions to client who will be breastfeeding/chest feeding the newborn. The nurse determines that the client has understood the instructions if the client makes which statements. Select all that apply. 1. I need to wear a bra that provides support. 2. Drinking alcohol can affect my milk supply. 3. I will start my estrogen birth control pills again as soon as I get home. 4. I know if my breasts/chest get engorged, I will limit my breastfeeding/chest feeding and supplement the baby. 5. I plan on having bottled water available in the refrigerator so I can get additional fluids easily. Explanation. Question 5. Rationale. The postpartum client needs to wear a bra that is well fitted and supportive. Common causes of decreased milk supply include formula use, inadequate rest or diet, smoking by the birthing parent or others in the home, and use of alcohol or medications. Breastfeeding/chest feeding clients need to increase their daily fluid intake. Having bottled water available indicates that the postpartum client understands the importance of increasing fluids. If engorgement occurs, the client should not limit breastfeeding/chest feeding but should breastfeed/chest feed frequently. Oral contraceptives containing estrogen are not recommended for breastfeeding/chest feeding parents. Test-taking strategy. Focus on the subject and note the words understood the instructions. Think about the physiology associated with milk production and the complications of breastfeeding/chest feeding to answer correctly. Question 6. The nurse is teaching a postpartum client about breastfeeding/chest feeding. Which instruction would the nurse plan to include in the teaching session? 1. The diet needs to include additional fluids. 2. Prenatal vitamins need to be discontinued. 3. Soap needs to be used to cleanse the breast/chest. 4. Birth control measures are unnecessary while breastfeeding/chest feeding. Explanation question 6. Rationale. The diet for a breastfeeding/chest feeding client needs to include additional fluids. Prenatal vitamins need to be taken as prescribed, and soap would not be used on the breast/chest because it tends to remove natural oils, which increases the chance of cracked nipples. Breastfeeding/chest feeding is not a method of contraception, so birth control measures should be resumed. Test-taking strategy. Note the subject, teaching for the breastfeeding/chest feeding client. Remember that fluids and calories should be increased when the client is breastfeeding/chest feeding. Question 7. The nurse is preparing to assess the uterine fundus of a client in the immediate postpartum period. After locating the fundus, the nurse notes that the uterus feels soft and boggy. Which nursing intervention is appropriate? 1. Elevate the client's legs. 2. Massage the fundus until it is firm. 3. Ask the client to turn on the left side. 4. Push on the uterus to assist in expressing clots. Explanation question 7. Rationale. If the uterus is not contracted firmly, the initial intervention is to massage the fundus until it is firm and to express clots that may have accumulated in the uterus. Elevating the client's legs and positioning the client on the side would not assist in managing uterine atony. Pushing on an uncontracted uterus can invert the uterus and cause massive hemorrhage. Test-taking strategy. Focus on the subject, a soft and boggy uterus. Visualize the situation and recall the therapeutic management for uterine atony. Remember that a full bladder displaces the uterus. Question 8. The nurse is caring for 4 one-day postpartum clients. Which client assessment requires the need for follow-up? 1. The client with mild after pains. 2. The client with a pulse rate of 60 beats per minute. 3. The client with colostrum discharge from both breast/chest. 4. The client with lochia that is red and has a foul-smelling odor. Explanation question 8. Rationale. Lochia, the discharge present after birth, is red for the first 1 to 3 days and gradually decreases in amount. Normal lochia has a fleshy odor or an odor similar to menstrual flow. Foul-smelling or purulent lochia usually indicates infection, and these findings are not normal. The other options are normal findings for a one-day postpartum client. Test-taking strategy. Note the strategic words, need for follow-up. These words indicate a negative event query and the need to select the abnormal assessment finding. Note the words foul-smelling in the correct option. Question 9. When performing a postpartum assessment on a client, the nurse notes the presence of clots in the lochia. The nurse examines the clots and notes that they are larger than 1 centimeter. Which nursing action is most appropriate? 1. Document the findings. 2. Notify the obstetrician, OB. 3. Reassess the client in 2 hours. 4. Encourage increased oral intake of fluids. Explanation question 9. Rationale. Normally, a few small clots may be noted in the lochia in the first 1 to 2 days after birth from pooling of blood in the vagina. Clots larger than 1 centimeter are considered abnormal. The cause of these clots, such as uterine atony or retained placental fragments, needs to be determined and treated to prevent further blood loss. Although the findings would be documented, the appropriate action is to notify the OB. Reassessing the client in 2 hours would delay necessary treatment. Increasing oral intake of fluids would not be a helpful action in this situation. Test-taking strategy. Note the strategic words, most appropriate. Focus on the words larger than 1 centimeter. Think about the significance of lochial clots in the postpartum period to answer correctly. Question 10. The nurse is monitoring the amount of lochia drainage in a client who is 2 hours postpartum and notes that the client has saturated a perineal pad in 15 minutes. What action would the nurse take initially? 1. Document the finding. 2. Encourage the client to ambulate. 3. Encourage the client to increase fluid intake. 4. Contact the obstetrician, OB, to report this finding.
Explanation question 10. Rationale. Lochia is the discharge from the uterus in the postpartum period. It consists of blood from the vessels of the placental site and debris from the decidua. The following can be used as a guide to determine the amount of flow. Scant equals less than 2.5 centimeters, less than 1 inch, on menstrual pad in 1 hour. Light equals less than 10 centimeters, less than 4 inches, on menstrual pad in 1 hour. Moderate equals less than 15 centimeters, less than 6 inches, on menstrual pad in 1 hour. Heavy equals saturated menstrual pad in 1 hour. And excessive equals menstrual pad saturated in 15 minutes. If the client is experiencing excessive bleeding, the nurse would contact the OB in the event that postpartum hemorrhage is occurring. It may be appropriate to encourage increased fluid intake. But this is not the initial action. It is not appropriate to encourage ambulation at this time. Documentation should occur once the client has been stabilized. Test-taking strategy. Note the strategic word, initially. Focus on the data in the question, a saturated perineal pad in 15 minutes. Next, determine if an abnormality exists. The data and the use of guidelines to determine the amount of local flow will help you determine that this is abnormal and warrants notification of the OB.
Question 11. The nurse has provided discharge instructions to a client who delivered a healthy newborn by cesarean delivery. Which statement made by the client indicates a need for further instruction? 1. I will begin abdominal exercises immediately. 2. I will notify my obstetrician if I develop a fever. 3. I will turn on my side and push up with my arms to get out of bed. 4. I will lift nothing heavier than my newborn baby for at least 2 weeks. Explanation question 11. Rationale. A cesarean delivery requires an incision made through the abdominal wall and into the uterus. Abdominal exercises would not start immediately after abdominal surgery. The client needs to wait at least 3 to 4 weeks post-operatively to allow for healing of the incision. Options 2, 3, and 4 are appropriate instructions for the client after a cesarean delivery. Test-taking strategy. Note the strategic words, need for further instruction. These words indicate a negative event query and ask you to select an option that is an incorrect statement. Keeping in mind that the client had a cesarean delivery and noting the word immediately in the correct option will assist in directing you to this option.